Welcome to the deep dive. So, today we're really zeroing in on something interesting in healthcare, using telemedicine to manage chronic diseases.
That's right.
You shared some info with us from Stark Medical Chico Primary Care, and, well, the idea is to really get a handle on how they're trying to make healthcare simpler for folks dealing with those long-term conditions.
Exactly. And doing it while keeping the quality of care, high.
Right.
We'll be digging into what Stark Medical actually offers. They're based up in Chico, California, but, and this is key, they're providing telehealth across the whole state.
Okay.
So the mission for you listening is to get a clear picture of how this telemedicine works for chronic conditions, what the potential upsides are, and which specific health issues they tackle.
Got it. Okay, so let's unpack Stark Medical first. Who exactly are they and, what's their angle?
Well, Stark Medical is a primary care practice, like I said, in Chico. It's run by Dr. Brandon Stark and Yvette Stark. She's a nurse practitioner. Yeah, exactly. A registered nurse, but with advanced training, so she can diagnose and treat conditions. What's really interesting is their big focus on telehealth.
Okay.
They do have in-person appointments, but only 1 week a month they're in Chico. Their main delivery method is virtual, reaching anyone in California.
Wow. Okay, so theoretically, if you live anywhere in California, you could connect with them. That's a pretty wide net.
It is.
And what kinds of services are we talking about here, specifically through telehealth?
Looking at their site, it seems they handle prescriptions, refills, and crucially, treatment for various chronic health problems, all online.
Right. Which brings us nicely to the main topic, managing these chronic diseases via telemedicine. Maybe just quickly for anyone listening, what exactly is a chronic disease in this context?
Good point. We're basically talking about health conditions that are, long-lasting. They often need continuous medical attention, lifestyle adjustments.
Like high blood pressure, diabetes, that sort of thing.
Exactly. Those kinds of things. Conditions you manage over the long haul.
And Stark Medical's philosophy on managing these remotely, what's their approach?
It looks like they aim to be really proactive and personalized, tailored to the individual. It's not just about coping. It's about actively managing the condition to maintain, a good quality of life. They really emphasize how critical good management is.
To avoid the bad stuff.
Yeah, exactly. Preventing serious complications, ending up in the hospital, or, worse outcomes, reduce life expectancy.
Makes total sense. Being proactive, not reactive. So what are the key pieces of this effective management, according to Stark?
They seem to highlight a few core things. Regular monitoring of whatever the condition is, preventive screenings to catch problems early,
Right.
lifestyle counseling, help with healthy habits, and really solid patient education, empowering people to be involved in their own care.
Okay, that sounds pretty comprehensive. Let's get into the specifics then. The info we have lists several conditions they focus on.
Yes, they call that high blood pressure, cholesterol management, diabetes, heart disease, and also migraines.
Interesting mix. Let's start with high blood pressure, hypertension. They call it the silent killer, right? Because you often don't feel it.
Precisely. It often has no obvious symptoms, which is why it's so dangerous.
So what's their telehealth strategy for that? How do you manage blood pressure from afar?
Well, this is where the remote monitoring piece seems really key. They guide patients on how to track their pressure at home,
Okay.
and then provide advice on lifestyle stuff, medications if needed, and build out a treatment plan. Plus, regular virtual check-ins are vital.
To see how things are going.
Exactly. Track progress, make adjustments to the care plan as needed. The goal is long-term control, preventing those big issues like heart attacks or strokes or kidney damage.
Okay, that sounds really hands-on, even though it's remote. What about cholesterol? Another big one for long-term health.
Yeah, high levels are a major risk for heart disease and stroke. For cholesterol, Stark Medical seems to use telehealth for the whole process, basically.
The whole thing, without clinic visits.
Apparently. They can refer you for the lab tests you need, then review the results with you online.
Ah, okay.
And then based on that, offer personalized recommendations, dietary changes, exercise advice, medication if it's warranted.
So from figuring out your risk to getting a plan, it could all potentially happen virtually. That's definitely convenient.
It really seems to be.
Now, diabetes, that needs constant attention, right?
Yeah.
Diet, blood sugar, meds. How does telehealth fit in there?
Yeah, this is where that continuous connection via telehealth can be super valuable. Stark Medical offers virtual diabetes management, which includes guidance on blood sugar monitoring, managing prescriptions, and personalized coaching on lifestyle.
Coaching too.
Yeah, lifestyle coaching. And they work with people across the spectrum, type 1, type 2, even prediabetes, creating plans that folks can actually integrate into their daily lives.
It really sounds like they're trying to make the care fit the person's life, not force the person to fit the care schedule.
That seems to be the goal.
Okay, what about heart disease? That's still a leading cause of death. How does telehealth play a role in such a critical area?
With heart disease, their telehealth approach seems to focus on a few key things.
Wow.
Carefully watching for symptoms, coordinating medications,
Which can be complex.
vary, and making adjustments to treatment plans when needed. But importantly, they also really push early intervention and long-term prevention
How so?
by educating patients on those vital lifestyle factors, nutrition, physical activity, stress management, things that make a difference over time.
So again, it's not just treating the immediate problem, but building healthier habits for the future, empowering the patient.
Exactly.
Now, migraines, they feel a bit different from, say, heart disease. How does telehealth work for migraine treatment and management?
Well, migraines can be just debilitating, right? And unpredictable.
Definitely.
So Stark Medical uses telehealth consultations to really dig into what the patient's experiencing. They work to assess the symptoms, try to identify potential trigger.
Ah, the triggers. Key for migraines.
Absolutely. And then they recommend different treatment options. Could be medications, maybe supplements, lifestyle changes, whatever might help reduce how often they happen and how bad they are.
Okay. So looking across all these different conditions, hypertension, cholesterol, diabetes, heart disease, migraines, it seems like telemedicine offers a pretty consistent set of potential benefits. Stark Medical's site highlights some of these broader points, doesn't it?
It does, yeah. They really emphasize convenience, obviously. Getting care from your own home, huge plus.
No travel, no waiting rooms.
Right. And accessibility is another big one. You don't necessarily have to take time off work, figure out transport. It removes barriers.
Makes sense.
And the continuity of care seems better, too. With those regular virtual check-ins, you stay connected to your provider.
Which means you can make changes faster.
Yeah, timely adjustments, addressing issues proactively instead of waiting weeks for an appointment. Plus, the support's more personalized, tailored plans. They also mentioned their platform is secure and easy to use.
Sounds very patient-focused, designed around, well, real life.
Wow.
Okay, so for anyone listening in California who's thinking, this might work for me, what are the practical steps? How do you use Stark Medical's telehealth?
Well, like we said, they serve anyone who resides in California.
Yeah.
To schedule something, they give a phone number, 530-514-0904.
Okay, 530-514-0904.
Right. And their website also has a bunch of resources. There's a patient portal, a new patient form, info on how they handle medication refills, and FAQ section. Looks pretty comprehensive.
And they do other things besides chronic care.
Yeah, they list general primary health care services, medication consultations. Oh, and interestingly, they even have their own podcast, the Stark Medical Primary Healthcare Telemedicine Podcast.
Huh, okay, so they're really all in on the virtual model, trying to make it easy and informative.
Seems that way, giving patients multiple roads to connect and get the info they need.
All right, so let's try and wrap up this deep dive. Looking at Stark Medical and their approach to chronic disease via telemedicine, it really seems like they're offering a convenient, accessible path for people all over California.
Yeah.
Managing these various long-term conditions, emphasizing that continuous care, personalized plans, proactive management, all potentially from your living room.
That's really the core idea, that ability to connect remotely with your doctor or NP for monitoring, med management, lifestyle advice. It could be a huge advantage if you're dealing with a chronic condition.
Absolutely. So for you listening, especially if you're in California, if you or someone you know is managing one of these conditions, maybe telehealth options like Stark Medical offers could genuinely simplify things, help you stay on top of your health more effectively.
Definitely something to consider. And it brings up a broader thought, doesn't it?
How so?
Well, thinking about how this rise in telehealth might really reshape the future of chronic disease care and maybe your own healthcare journey overall.
That's a great point. What other parts of healthcare could benefit from this kind of virtual approach? And what questions does it raise for you, the listener, about where patient care is heading? Something to think about.